From the San Francisco Public Press, you're listening to Civic, where we investigate the policies and institutions that govern our lives. As overdose fatalities reach 2 to 3 deaths a day in San Francisco, demands for places to consume drugs under supervision are getting more urgent.
If my friend Clovis had somewhere besides a BART station floor to use, he might still be here.
But officials decided against taking that potentially life-saving measure, despite the city's reputation as a pioneer in harm reduction.
Why isn't San Francisco just being San Francisco? During that time, people who got HIV or AIDS, gay men are getting it because they're heathens, right? San Francisco was like, no, we're gonna treat them like beautiful humans.
Today, we take an in-depth look at San Francisco's decades-long campaign to open safe consumption sites and how New York City is making it happen. I'm Sylvie Sturm, and this is Civic. Back in the early 2000s, I was a journalism student, reporting on Vancouver's downtown east side, a neighborhood that mirrors the Tenderloin in many ways. It borders Chinatown and some of the city's most popular tourism spots. It's dominated by single-room occupancy buildings, and most of its residents are poor. In fact, it's the poorest postal code in Canada. And just like the Tenderloin, it was beset by a dual public health crisis of drug addiction and homelessness. Back then, it was common to see discarded needles in the gutters and people injecting themselves or nodding off in doorways. Vancouver's health agency produced a video in 2006 describing the disturbing scene.
Because they're poor and marginalized, many end up injecting their drugs in the streets and back alleys in very unsanitary conditions.
I usually go in a doorway like this, and as you can see, the sidewalk here is covered with human excrement.
They end up with lots of abscesses, which for a healthy person it may clear up right away, but for them it turns into a big ulcer, either on their arm or their leg. Could be in their neck, could be anywhere they're injecting. The other thing is that can go on to develop septicemia or blood poisoning, and they can, end up in the hospital with septic shock.
Well, without access to clean needles, people have been converting to HIV at a very rapid rate. So what we've seen in the last 8 years is a tremendous number of people dying of AIDS. In addition to that, there's a horrendous overdose rate.
So what did they do about the crisis? Well, this is where comparisons between the two neighborhoods have to end. That's because Canada is the land of socialized medicine. Healthcare is based on need rather than ability to pay. So that philosophy was a crucial motivation for what ultimately happened. Well, that and cost.
There's a huge financial burden on the healthcare system.
The cost of intravenous drug users continues to go up. The cost of getting an HIV infection, huge.
Many people have open wounds that are open for a year and a half. That results in skin grafting, so they have to go up to plastic surgery. It's specialists. Even then it doesn't heal properly, and then they need amputations. So when you add it all up, it's a huge cost to our system.
There was one obvious solution that would ease both the suffering of drug users and the burden on hospitals, and that was legal, safe injection centers. Also called supervised consumption sites or overdose prevention centers, these are places where people could bring illicit drugs and consume them without fear of harassment under medical supervision in case of an overdose. They had emerged in cities in Switzerland, Spain, Germany, and the Netherlands in the mid-90s as a solution to overdose deaths. At the same time, the goal was to reduce public drug use and promote access to social services, healthcare, and drug treatment. The health ministries from these countries published studies of their consumption sites that showed they improved client health and reduced public nuisance. So, Canada decided to try them out. Vancouver's health agency opened North America's first sanctioned supervised injection facility on September 14, 2003. They called it Insight.
Clients coming to the door are buzzed in by a staff member at reception.
Just the regular?
They're led through a waiting area to a secured door into a 12-seat injection room where they first wash their hands. Then they're given a disposable injection kit that includes clean needles, cookers, tourniquets, and clean water. In a mirrored stall, under the supervision of trained medical staff, they inject their own drugs.
So, was it successful? During the past 20 years, there have been more than 36 peer-reviewed papers on Insight, making it one of the most evaluated healthcare programs in the history of Canada. Laura Thomas is Director of Harm Reduction Policy at the San Francisco AIDS Foundation. She talked to the San Francisco Board of Supervisors about its success in April 2019.
About 30% of the people who access Insight every year go on to treatment. And in fact, people who go to Insight are more likely to go to treatment and more likely to stop using substances than people who don't go to Insight. They're effective at reducing HIV and Hep C transmissions. And one of the most, to me, compelling statistics is that of the now hundreds of supervised consumption services around the world, or at least over 120, and the millions of injections that have happened in them, there's never been a death from overdose in any of these sites. There have been overdoses, but they've all been reversed.
In this country, safe consumption sites are not permitted under a federal law known as the Crack House Statute. That makes it a serious crime to open or maintain any building for the purpose of using a controlled substance. But there was a slim chance that San Francisco would get special dispensation when state lawmakers supported a bill in the summer of 2022 drafted by State Senator Scott Wiener, who represents San Francisco. That bill would have allowed the city to open a supervised consumption site, but Governor Gavin Newsom vetoed it. Newsom said he was, quote, acutely concerned about the operations of safe injection sites without strong, engaged local leadership and well-documented, vetted, and thoughtful operational and sustainability plans, unquote. That's despite all the studies and despite support for overdose prevention centers from Mayor London Breed and a majority of the Board of Supervisors. Elected officials and healthcare leaders support them because studies specific to San Francisco have shown that the city would benefit in a variety of ways. Researchers conducted a cost-benefit analysis published in December 2016 in the Journal of Drug Issues. Here's Laura Thomas talking about its findings and previous research during a lecture broadcast by UCTV in August 2019.
We would avert HIV cases, prevent hepatitis C cases, as well as being able to connect people with treatment, and overall found that it would save San Francisco millions of dollars if we opened one. Some of the research here in San Francisco, research from way back in 2010, 85% of people who inject drugs said they would use it, but they're not going to travel very far for it, so it needs to be located somewhere convenient for them. And we did an informal survey. This was an intern with me who surveyed businesses in the Tenderloin, and unsurprisingly, business owners in the Tenderloin and employees, the vast majority of them had seen people injecting in public and thought it was a problem for their business. Public drug use was a problem for their business. And then again, once the concept was explained to them, they thought this was a good idea and would help address some of the problems that they were facing. And certainly I know a lot of people are supporting this because their primary concern is public injection. They don't want visitors, people going to businesses downtown to see people injecting in public. Other folks are primarily worried about overdose deaths and keeping people alive or the cost to the city. But from my perspective, the people who use drugs deserve to be treated with compassion and dignity, and this is the best way that we're going to be able to provide them with that respect and dignity.
San Francisco's advocacy groups and the public health sector have been trying to follow Vancouver's lead for years. Back in 2007, San Francisco's Department of Public Health and an alliance of supporters sponsored a public discussion on the idea of opening a safe consumption site. Laura Thomas was there.
And we got some political backlash from that, from right-wing radio and conservative senators and so on, and it sort of put a damper on the conversation around this.
While discussions over safe consumption centers waned, addiction health experts continue to embrace harm reduction strategies. Harm reduction is a healthcare approach that does not require people to stop taking drugs to get support. Instead, the goal is to help improve the health of people suffering from addiction by providing clean drug supplies, basic medical and hygiene care, some food, and shelter. Access to detox and treatment services are also available for the asking, but the priority is to treat them with dignity and respect. And as overdose fatalities keep going up, demands for overdose prevention centers are growing increasingly frantic. Philip Lassiter managed mobile syringe services at the San Francisco AIDS Foundation for 3 years. He spoke at a rally at City Hall on August 31st, Overdose Awareness Day.
I used substances, predominantly meth, for 26 years. Meth provided a powerful solution that I was not willing to give up until I was ready to. I was thrown in jail 4 times. I became unhoused, unemployable, HIV positive, Hep C positive, mentally unstable, and disconnected from family and friends. I tell you this to dispel the notion that consequences are solutions to substance use disorder. If they were, I probably would have stopped before all that. They may work for some people, but they do not work for most people. Substance use disorder cannot be punished away. The war on drugs has never worked, and it never will. I now have 10 years of uninterrupted abstinence through a program of recovery. Harm reduction is now, and always has been, my solution. Where there was no desire or intention to stop, harm reduction was there. Where there was desire without readiness, harm reduction was there. Where there was readiness, action, and setbacks, harm reduction was there. And now, with just over 10 years, harm reduction is here.
Lassiter talked about a friend who died as a result of his substance use disorder.
Let me tell you about my friend Clovis. When we met, we were both volunteering at an organization called the Castro Country Club, a beloved community center for people in recovery. We discovered that we were both huge Whitney Houston fans, and that became the thing that we bonded over. I continually flaunted my collection of memorabilia to remind him who the bigger fan was. He was my friend, my peer, my fellow, and my Whitney buddy. Last Monday, y'all may have seen an article. There was a man found dead from overdose on the floor of a downtown BART station. It was Clovis. 2 days prior to that, I attended a memorial for another friend who had died from overdose. 1 week prior to that, there was a memorial for another friend who died from overdose. When I think about the loss of my friends, I get very sad. When I think about the fact that they were preventable, I get very mad. I get angry at the weakness and cowardice of the leadership we currently have in this amazing city. San Francisco leadership should be audacious and bold. It should lead the way in the implementation of solutions perceived as controversial or radical. Controversial and radical is what we do. If my friend Clovis had somewhere besides a BART station floor to use, he might still be here. Implement overdose prevention sites now. People are dying.
A few years ago, advocates became hopeful when the Department of Public Health released an overdose prevention plan that included several safe consumption sites across the city as its cornerstone. These sites would be located in drop-in centers called wellness hubs that would also include wraparound services like healthcare, food assistance, and connection to treatment. Then, in May 2023, the city received a windfall of nearly $300 million after winning lawsuits against multiple opioid manufacturers, distributors, and retailers, which were found largely responsible for the opioid addiction crisis. The city's 2-year budget allotted $18.6 million towards these new wellness hubs, so it seemed that progress was underway. But then San Francisco's city attorney, David Chu, said the city couldn't put any money towards safe consumption sites because they were against the law. But he suggested a workaround: get a nonprofit organization to fund and operate the safe consumption of drugs inside a city-funded wellness hub. The city would pay for what's called wraparound services, meaning clean needles, medical care, hygiene supplies, food, and connections to shelter, housing, counseling, and treatment. The idea is that it would mimic a model being used in New York City. On Point NYC is a nonprofit harm reduction organization operating 2 overdose prevention centers in Manhattan, one in East Harlem and one in Washington Heights. The locations opened on November 30th, 2021. The City of New York keeps itself safe from legal liability by funding only the wraparound services like healthcare, social services, connection to housing, and even acupressure sessions. Here in San Francisco, 3 agencies said they wanted to open overdose prevention sites: the San Francisco AIDS Foundation, the Gubbio Project, and Health Right 360, which the health department already contracts to provide treatment services throughout the city. But these organizations told me that coming up with the hundreds of thousands of dollars it takes each year to run overdose prevention services would be a monumental, if not impossible, task. Nevertheless, in early October, Health Right 360's Gary McCoy flew home from Washington, D.C. with some big news.
At the direction of City Attorney David Chu and Mayor Breed and her office last year, we started working diligently to identify private funding for the overdose prevention piece of a wellness hub. And we've been able to identify 2 different funders to be able to operate the overdose prevention piece of a wellness hub. Right now, we have enough money for 1 site for a full year. I think we're hopeful that once we sort of move further along in the formal process of implementing wellness hubs, that we'll be able to have other people step up and graciously donate private funds as well.
So, problem solved, right? Maybe not. Even though the Public Health Department initiated the whole idea of safe consumption sites more than 15 years ago, there's now a conspicuous lack of enthusiasm over this news. I asked the Public Health Department what comes next, and 5 days after the San Francisco Examiner published a story about Health Right 360's funding, a story that the department was quoted in, I received the same written statement. It read, quote, "We have not been informed that any nonprofit has succeeded in raising funds. However, once the funds are raised, there are a number of complex legal, procurement, location, and community factors that need to be addressed," unquote. That left me wondering, where's the urgency? Every day that passes sees 2 or 3 more people dead of an overdose in the city. I spoke with Supervisor Hillary Ronan. She's probably the loudest proponent of overdose prevention centers on the city's Board of Supervisors.
DPH gave us an initial timeline that had the first OPC opening in March of 2025. So I was like, okay, clearly this is not a priority, right? Like that's not an urgent priority to deal with the fact that 2 to 3 people a day are dying of drug overdose. So I went back to the mayor and I said, are you serious about this? Because what is happening is not a serious endeavor. And I'm kind of getting mixed signals. So at this point, I don't think there's a serious effort on the mayor's office to open these. The mayor and her allies they believe that OPCs are enabling, despite all the evidence to the contrary. And they want to and are arresting drug users, taking away their welfare, and using a primary punitive approach to what is a health crisis. And the Department of Public Health just does what she tells them to do, which is also a problem because, in my opinion, they're doctors. They have a duty to do everything in their power to save their patients' lives. They know this is one of the most effective interventions for doing that. They not only know it, they cited it as their plan in their report as one of the most effective interventions, and yet they're not doing it because they don't do anything that the mayor's office doesn't let them do. And I think that's problematic. There's a good chance that Health Right 360 is going to have to give back hundreds of thousands of dollars, and that we're just going to see more and more people die of drug overdose in the city.
It seems clear that San Francisco hasn't surmounted the legal or ideological obstacles impeding its progress. In fact, a new well-funded political lobbying group called Together SF is campaigning against overdose prevention services. The group's campaign literature argues that overdose prevention centers are counterproductive. They use a quote from Stanford University addiction specialist Keith Humphreys that basically says seeking treatment where people are using drugs is like having an AA meeting in a bar. Harm reduction advocates say that overdose prevention centers are not meant to get people into abstinence-based treatment, but to keep them as healthy as possible while they try to survive their disease.
What we know about a person who comes to use an overdose prevention site is that they care about their health. Just the act of walking in the door is an expression of care about their own health. Once you know that, you have an ability to start that conversation.
That's Lydia Branston. She runs the Gubbio Project, which provides unhoused people a space to rest, snack, drink coffee, and access basic health and hygiene services.
Working through chronic addiction issues and substance use disorders requires an enormous amount of self-care, self-love, and community support. And when you go to a 12-step meeting, you get that, right? That is what people are attracted to in those meetings. You get that community support. You're being told that you're of value. I believe that people who use drugs also should get that support, like that you don't have to wait. That sometimes that love alone and that commitment to that person's health is what moves them into the direction of seeing that there is a path for them outside of the drugs. So, yes, we want to have people here, and no, we're not going to lead with it. This is one of the things it's like that we hear is like, oh, well, I went in to get supplies and no one said to me, do you know where to get treatment? In order to build these trusting relationships, we have to start with where these people are. And then when we got a relationship with them, start going down that path. Otherwise, we'll just chase them out the door.
San Francisco pioneered the harm reduction philosophy in 1967 when the Haight-Ashbury Free Medical Clinic provided health care to crowds of young people who heeded the call to turn on, tune in, and drop out. But today, some are trying to shift the focus to redefine just who is being harmed. Here's Supervisor Matt Dorsey.
We do have to take the principles of harm reduction seriously, in that part of it is reducing harms to the community. And I would challenge people to ask communities if they feel that the city is taking seriously the harms that they're suffering as a neighborhood.
Dorsey has long supported supervised consumption sites, but in their absence, he's demanded that the entire $18.6 million budgeted for wellness hubs be directed to jails instead. He says there's a sense of permissiveness in the current harm reduction approach that sends the wrong message.
It's also resulting in a level of drug tourism, or San Francisco becoming a destination city for drug use. It is observably true that there is a significant portion of people who are coming here who are not from San Francisco. When the police started making arrests of individuals for public drug use, the finding was that as many as 90% or more of the individuals who were here using were not from San Francisco. I think that is a problem not just for San Franciscans and San Francisco taxpayers, but also for the population that we're trying to help.
That statistic is from a report delivered by Police Chief Bill Scott to the Police Commission last June. Dorsey used this report to advocate for coercing people into drug treatment through arrest and incarceration. But those numbers don't square with a San Francisco Chief Medical Examiner report that showed 92% of people who died of overdose from January to September this year were from San Francisco. Dorsey said this feels personal since he's struggled with addiction himself.
I've also lived this, and I also know that there's a better life on the other side of addiction if we can get people there.
Dorsey often refers to his own experiences while taking a tough love approach. Like the time he tweeted, quote, "The most compassionate, most life-saving message we can send is this: the party is over," end quote. And I've heard others criticize him for it. I've also heard people say that it's somewhat disingenuous of you to sort of put yourself in the same category as somebody who is in a maybe lifelong, very serious, almost on death's door kind of level of addiction and unhoused. I mean, you likened it to partying in one of your tweets, which it doesn't look at all like partying whatsoever when you see people's flesh rotting off and living every minute of the day just for their next fix. So Saying that you lived it can be considered a little disingenuous, no?
I think people struggle with addiction in many different ways, but I also don't make any representation that what works for me worked for others. And I think that's true of most people who have had success in recovery, that my addiction qualifies me to judge my addiction.
I asked Alex Kroll whether he believes that harm reduction services attract drug users to the city. He's a San Francisco-based epidemiologist with expertise in substance use and overdose prevention centers.
The notion that it would lead to more drug use or people coming to start use drug use, it doesn't really make any sense.
Kroll has studied safe consumption sites in San Francisco and in other cities for more than a decade.
There's no data showing this. I think in general, the vast majority of people who choose to use a site are people who have been using drugs for a long time. People don't just sort of decide, oh, I'm going to start using heroin now, and oh, let me go to one of these sites and do that. In part because there's so much stigma in our community about drug use, and also because it's illegal to use drugs. In general, the people who go to these types of sites are people who've come to terms with the fact that they've been using drugs a long time and they've got a problem and they need some help.
So in San Francisco, we're seeing this apparent pushback against harm reduction. Meanwhile, in New York, things seem to be going in a totally different direction. Since November 2021, 2 overdose prevention centers have been operating in Manhattan with the blessing of the city's top elected and health officials. The centers were authorized through executive action by former Mayor Bill de Blasio shortly before he left office. When he announced their launch at a press conference, he was joined by a whole bunch of dignitaries, from state senators to crime commissioners to health officers.
Last year in New York City, we lost over 2,000 New Yorkers to overdose deaths related to opioids. Nationally, staggering figure, over 90,000 Americans lost in 2020 to opioid overdoses. This is literally the worst year on record. It is frightening. And it continues to be a profound challenge. And when you see something this bad, you cannot just do business as usual. You can't say the status quo is acceptable. It's not. We have to do something very different. That's why we launched yesterday the nation's first overdose prevention centers. This is a crucial step to saving lives. The bottom line of an overdose prevention center is, in one of these centers, lives are saved. It's very important for people to understand this. This is a medical facility. This is a place where medical personnel are present to save lives. The difference between someone tragically addicted and shooting up alone, somewhere isolated, and overdosing, and there's no one to help them, and help doesn't come in time, and we lose a loved one. The difference between that and having someone who's dealing with an addiction problem in a medical facility, getting supervision, getting immediate help if they need it, that's a world of difference right there. This is the time for this approach. It's something that's been looked at for a long time. It's been studied very carefully. There are real concerns, and it's important that we talk about those concerns. But what is abundantly clear is this is a way to save lives. And we need it more than ever, given what we're seeing with these horrible overdose realities around this city. So we're moving forward, and then from there, we're going to be able to reach more and more people. And we're doing this for the people in New York City. We're doing this to save lives. We're doing this for our families. We also know that this, as first in the nation, opens the door for this to be a way of helping people and saving lives all over the country. It had to start somewhere. It was important to show that this would work and save lives. New York City decided to be the place that would start this effort. And I look forward to the day when we can save lives all over the country with this approach and turn people's lives around and get them to treatment. That's why we're doing this.
I traveled to New York to visit On Point in Harlem back in May. It's located on a narrow street near an elevated train. A black and yellow awning emblazed with On Point and another with Welcome and Bienvenidos hang over the front door. Inside is a wide open space, a waiting area with several dozen mostly occupied chairs. Conversations echo off the walls. I talked to a client who asked that I not share his name because he's from San Francisco. He said that On Point has been a lifesaver.
They've actually brought me back to life 2 times here. Like when I first started using again, I hadn't used in a long time, and they brought me back.
He said the alternative was much worse.
I used to use in bathrooms. I'm used to doing that, and all over San Francisco, I know where every bathroom is that you can use, and now in New York, I know where every bathroom is you can use. Risking getting caught and dying in the bathroom, then kicking the door in and getting arrested, or also just overdosing and dying.
Having a safe, hygienic place to consume drugs also allows him to live the rest of his life in relative stability.
I have a job and, I do all the good things, so I have a life. I have a girlfriend, and my life is good, actually.
I also talked to Sam Rivera, On Point's executive director. He was named one of Time magazine's 100 most influential people of 2023 for his work with the centers. His organization has had a transformational effect on the 2 neighborhoods where they operate.
We have reduced the stress on the medical system in New York City in 2 neighborhoods. In a year and a half, 80,000 times people didn't use in the street, they didn't use in public, they didn't use in children's playgrounds, all these things that society and community, which we agree, don't want. They used inside in a safe environment where they were welcomed and treated with dignity. And 80,000 times, we're coming up on almost 1,000 overdose interventions, 0 death. Not only 0 death, but people treated with dignity and feeling better about themselves, able to have a relationship with themselves that they've never had. The stories, all the anecdotal things around reunification with children and reunification with families and reemployment, becoming employable again and employed. These are things that would never happen for these folks.
Rivera's whole philosophy is to lead with love. That's a theme I encountered throughout the entire facility. Juan Cortez is the manager of On Point's Holistic Healing Center.
When people come through the door, they're met by love, and then the healing process begins.
It's a dimly lit space on the 2nd floor, away from the chaos of the waiting area. The setting is serene. The only sound you might hear is the low rumble of a gong used for sound therapy.
This beautiful sanctuary set up for people that normally would never dream of receiving such services. Most people associate things like massage therapy and acupressure and acupuncture sound therapy and Reiki and things like yoga and Tai Chi with like a spa day. So it's really accessible to people who could afford it. So people in poor communities never really have much access to it, especially people who identify as using drugs. People that have been stigmatized by society have been told their whole life that they're a piece of garbage. So if you tell someone they're a piece of garbage long enough, they tend to believe it. So why practice self-care and why practice holistic healing methods if you're a piece of garbage? So what we do is we provide a space for people to come here, and we call it a sanctuary. And the main ingredient is love.
Rivera said that he can't make sense of comments like Mayor Breed's, who says compassion is killing people and we're loving drug users to death.
Like, just think of that, right? Like in our culture, my culture, indigenous culture, loving them to death? Like there's not even such a thing, right? There isn't. I say we love on people until they're ready to love on themselves, whatever that means, and we'll continue. What the folks in San Francisco aren't understanding, and this is why I want to say this 5 more times, 80,000 times, the people that you're so worried about using in the street and the Tenderloin and all these places would be indoors. You won't see them. They'll be indoors, being loved on too much, being cared for, being treated with dignity and respect. And so they'll be indoors and doing all those things you have concerns about. I've been in this work 31 years, did a lot of work around HIV. And then we saw San Francisco as even ahead of us, right, in New York. The response, in my opinion, as a New Yorker, to what was happening in San Francisco around gay rights, and it was like, they have it, they know it, they're human. They're humanizing HIV and AIDS, right? They were, during that time, people who got HIV or AIDS were like, we had people saying, those gays and lesbians are getting, well, mostly gays, right? Gay men are getting it because they're committing, they're heathens, right? And the Bible says, I mean, think about that. San Francisco was like, no, they're beautiful humans, and we're going to treat them like beautiful humans, and we're going to love on them like beautiful humans, right? And then we were doing the same here. So it's interesting how, or shocking in a way, how that shifted, right? What happened? It's funny, if you heard me speak with the supervisors, it's like, if there was a one-liner, it would be, why isn't San Francisco just being San Francisco? And when I say that to people from San Francisco, they go, holy shit, like, yeah, why aren't you just being San Franciscans? Like, why aren't you? Because the progressive, loving, kind-hearted approach that I've experienced when I've been in San Francisco, it's just surprising for me.
I get it. It feels like San Francisco is experiencing a dramatic about-face for a city that's been leading the harm reduction movement for 30 years. In March 1993, San Francisco was one of the first cities in the country to take on the controversial practice of handing out clean needles to mitigate the spread of HIV. The governor at the time, Pete Wilson, had made it illegal to pass out needles, saying it encouraged drug use and undermined law enforcement. But then Mayor Frank Jordan declared a citywide emergency to skirt the law, saving who knows how many lives. And in 2000, the San Francisco Health Commission made harm reduction its official public health policy. Then, in December 2021, Mayor Breed declared a citywide emergency to address a drug-related public health crisis.
We had over 700 people alone die due to a drug overdose last year in San Francisco. We have over 600 and counting this year. When we look at the conditions on our streets, it is really unfortunate, it's sad, it's heartbreaking.
The declaration let the city bypass rules for issuing contracts and zoning and planning restrictions to open a temporary site where people could get off the street and access health services.
It's about getting people the help that they need and being able to do so quickly. I've said this time and time again. If you don't know what it's like to experience an addiction, and I hope to God you never find out, we have to meet people where they are. We can't wait for something to be set up. We have to move quickly. We can't wait until something goes through a layered process. We have to move quickly.
The temporary site consisted of event tents surrounded by privacy fencing at UN Plaza on the edge of the Tenderloin and south of Market. The Tenderloin Linkage Center, as it was called, involved several community-based organizations, including Urban Alchemy, Code Tenderloin, and Health Right 360. The plan was for it to operate for 12 months. News reports like this one from KPIX announced its opening on January 18, 2022.
The Linkage Center offers short-term services like food, beverages, and showers with the hope that by forging a bond with those who need those services, it will then have them take advantage of longer-term opportunities to get health treatment and permanent housing.
But the public wasn't told that people would be allowed to consume drugs on the premises. This was done under medical supervision in case they overdosed. The goal of saving lives worked. During its 11 months in operation, the center's staff reversed 333 overdoses. But when word spread that people were using drugs in the space, there was a backlash. Here's how KTVU reported it.
A group of women here holding photos of their sons and daughters they say are recovering drug addicts, and now they are asking the city to shut down this Linkage Center. A group of advocates who are in support of the Linkage Center also out here as well.
Breed pushed back against the protest during a press conference in January 2022.
We're hopeful that in the coming months, as we continue to try and address this, it will be a noticeable difference, and people will not be so focused on, well, what's going on at the Linkage Center? We don't think it's right. Well, you know what? I don't think it's right to see it out on the streets in front of kids and to walk past needles and feces either. So, we got to pick our battles here. This is a solution that we are hopeful will lead to real change and will really lead to less crime and also less overdose deaths in San Francisco.
the center shut down in early December 2022, which was a month earlier than planned. Adriel Coda was one of its clients. I caught up with him sitting outside the center a few days after it closed.
I went there for various resources like a meal. They also had dog food, clothing, shower, laundry services too. If you would take a shower, they'd wash your clothes, and before you got out of the shower, your clothes would be ready. There's some other places, but they're kind of out of the way. It's not every day like they did here. Every day they had showers and laundry and food. Other places are limited to like once a week or twice a week. There's like meals here and there, and then there's random like church people who come around giving people meals and whatnot. But yeah, there's not really a regular like source of food that we can come to.
Along with reversing more than 300 overdoses, the center's staff provided services to more than 400 people every day for a total of 100,000 visits. They linked more than 2,800 people to medical care and housing or shelter, referred almost 6,000 people to social services, and enrolled more than 600 people in government benefits. And it appeared to benefit the surrounding neighborhood as well. According to research analyzed by the Chronicle, in 2019, there was a 65% chance of finding a drug-related issue on any given nearby block. In 2022, the chance dropped to 46%. I spoke to James Augenbaugh, who lives nearby and was out walking his dog. He said he saw less public drug use and fewer discarded needles in the immediate area.
It doesn't hurt anybody. It's actually, if anything, it's better. Because at least all the needles are going somewhere safe instead of on the streets. Yeah, because I mean, look at the streets now. This is clean. It didn't always used to be like this. You know, people aren't on the streets or in bathrooms, you know, because that was getting kind of bad in Tenderloin and stuff too for a little bit. It was a lot better, a lot cleaner. I don't have to worry about her stepping on a needle.
Nevertheless, Breed said she was disappointed that 163 people were referred to substance use treatment programs and 38 entered treatment. Health Right 360 was one of the organizations contracted to operate the Tenderloin Center. Gary McCoy said it was unrealistic to expect the center's clients to immediately accept offers of drug treatment.
I'm not sure where it came from, but there was an expectation that, everybody coming into the center voluntarily were just clamoring to get into treatment and that we just didn't have better access to treatment. But I mean, the reality is that a program like TLC is meant to have those conversations, regardless of how long that might take, with somebody to tell them that these other options exist and to try to build that trust with them and to provide that dignity with them while saving their life if they have an accidental overdose.
We'll never know whether the Tenderloin Center could have reproduced the results of Vancouver's Insight. A study published in Addiction Journal 4 years after Insight opened concluded that the center was associated with a 30% increase in detox services, and that coincided with increased rates of long-term addiction treatment and reduced use of the injection site. Tragically, evidence of the Tenderloin Center's potential benefits became obvious to many harm reduction advocates once it shut down. In November 2022, during the center's final full month in operation, 61 people died of overdose in San Francisco. 2 months later, the number had surged to 83 deaths in 1 month.
When TLC was open and we had a safe place for folks to go, the numbers went down. So it's pretty telling data.
Although Breed once supported safe consumption sites, she now appears to be souring on the idea. Here she is during a heated exchange with Supervisor Dean Preston during the mayor's question period at a Board of Supervisors hearing last June.
Let's talk about this wellness hub, this linkage center that we closed. In fact, many of the people that I grew up with have said that when they walked in the linkage center, they felt like people were excited and happy that they were using drugs. They felt like they weren't getting help. They weren't getting support. They were upset about that. And the fact is, the linkage center wasn't doing what it was supposed to be doing.
McCoy refuted the notion that clients resented the experience they had at the Tenderloin Center.
Word had gotten around from all of the announcements and the notifications that the site was closing, and there were folks that had come in very consistently for the first couple of months that ultimately ended up getting connected to housing and getting some type of shelter, and we didn't see them for a long time, and they were coming in on the last day and bringing us flowers and thank you cards, and it was very emotional and upset that what had helped them is no longer going to exist for other people.
Even though some factions are working against overdose prevention centers, harm reduction activists aren't giving up. They've been erecting pop-up safe consumption sites in the worst-hit areas of the city. Supervisor Ronan participated in one pop-up site on August 31st, Overdose Prevention Awareness Day. But she said that was an act of civil disobedience, not a solution.
When it's outside, it's just not the real model that works. You can't do it in the same way. And it doesn't improve the street conditions, which is part of why the model is so wonderful. It's like you can actually save people's lives and do this really positive health intervention, and at the same time address one of the worst things happening in San Francisco right now, which is the really chaotic street conditions in certain neighborhoods.
In our next episode, I'll talk to the generation that's growing up during this crisis and what they're doing to help save the lives of their peers, friends, loved ones, and strangers.
We're not really sure where they are right now, but we have a feeling that they're not here because they did a lot of drugs and, we're just rebelling a lot. And sometimes we talk about it with my other friends, like, I wonder where they're at now.
I'm Sylvie Sturm, and you've been listening to Civic. Civic comes to you from KSFP LP 102.5 FM in San Francisco. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes producer Leanna Wilcox and contributor Mel Baker, who is also the program director at KSFP. Cynthia Chavez is our vocal coach. KSFP is a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find our reporting at sfpublicpress.org. Subscribe to our podcast by looking for Civic from the San Francisco Public Press wherever you get your podcasts. We're the one with San Francisco's skyline in our logo. Thanks for listening.